All right, Methodist Labanner Healthcare recently conducted a community health needs assessment last year. The results of the survey pointed to a need and targeted focus on cardiovascular and oncology services. I'm joined now by cardiologist with Methodist Labanner Healthcare, Marin Tashom. She is joining us to talk about that assessment. Good morning, doctor. How are you?
Yes, we did conduct a community health needs assessment in the year 2022, and the study revealed that heart disease is a big problem in our community. It is the leading cause of death, and in the year 2020, actually, a quarter of deaths in DeSoto County and Shelby County were accounted for by heart disease, so big problem with heart disease.
Yeah, it's something that, it's the #1 killer for both men and women across the U.S. Certainly, it's prevalent here. Let's talk about those health disparities when it comes to DeSoto, Shelby County, African Americans, and others.
That's a good point. There is a big gender and racial disparities when it comes to heart health, right? In Shelby County and DeSoto County, both African Americans are more likely to have heart disease. Not only are they more likely to have it, they're more likely to die from it. For example, in Shelby County, Black people are 1.6 times more likely to die from it compared to white people. So big problem with health disparity.
Okay, yeah, it's any of the reasons behind that? Why is there such a big disparity, doctor?
You know what? There's a myriad of factors that come into play. African Americans are more likely to have risk factors of heart disease, more likely to have hypertension, diabetes, obesity. There's also a big wealth disparity, poverty, lack of transportation, access to healthcare, and really limited health awareness. Not only that, our dark history of racism and mistreatment in the medical field of people of color really resulted in a deep rooted mistrust of healthcare workers in this community. So all these factors and, more socioeconomic problems really are causing a big problem to this community.
So what is Methodist Labanner Healthcare doing to address some of these disparities?
You know what? Methodist Healthcare is the only healthcare system that's located in every corner of the community, including underserved communities, to make sure that people have access to quality healthcare. We do have free diabetes classes, to increase health awareness in our community. And really, if people go to our website, methodisthealth.org, there will be a lot of resources that they can take advantage of.
What's the best ways, if you were to just kind of do a little rundown here, doctor, the best ways for people to make sure they have a healthy heart?
Excellent question. I'd say know your number, know your baseline. What's your blood pressure number? What's your diabetes number? Do you already have a primary care doctor? If not, go get yourself one. Make sure your blood pressure is okay, and they will have a good idea of your baseline for future references. Really, if you're seeing a specialist, go see your specialist doctor on a regular basis and really know your baseline.
Anything else you want to mention before we let you go, doctor, about heart health, about what the survey and assessment said for the Mid-South?
Really know your baseline, know your family history, go see your primary care doctor, and also visit our website, methodisthealth.org, to get more information.
Okay, Dr. Marin Tashom, a cardiologist with Methodist Labanner Healthcare. We appreciate your time. Thanks so much for the deep dive into that health assessment. Appreciate it.
Thank you.